Hello, I'm Dr. James Ludwig, and I'm going to teach you how to treat your nasal allergies. So what are nasal allergies again? Nasal allergies are when things like pollen and dust land inside your nose and create inflammation. And this inflammation creates lots of symptoms like itching, sneezing, postnasal drip, and problems breathing through your nose. Patients are always asking me what medications they should use to treat their nasal allergies. So let's look at the different medications and figure out which ones you should be using for which symptoms. So there are four main types of allergy medications that you can use to treat your allergy symptoms, and everything else is just a combination of those products. So first we have saltwater irrigation products, then there's topical steroids, antihistamines, and then decongestants. And then other products are just a combination usually of these different things. The first thing you should do is wash your nose with a good saltwater product and make sure you use distilled water so you don't have a lot of heavy metals and ions and things in there that would irritate your nasal cavity. Probably the most important product to use when treating your nasal allergies on a daily basis are topical steroids, such as Q-Nasal, or there's other ones such as Flonase or Nasonex. Now, topical steroids work by blocking the inflammatory reaction that incites all the symptoms that you're suffering from nasal allergies. That's why you have to use it every day. If your symptoms are just in your nose, that's where you have your allergy. You have sneezing, postnasal drip, itchy nose. You want to put the medicine where the problem is. And so the best choice for nasal allergies are topical antihistamine sprays. So when you have this inflammatory reaction in your nose, it causes the release of histamine. And histamine causes lots of the itching and sneezing that you experience from nasal allergies. Now the nice thing about antihistamines is that you can use them as needed. You don't necessarily need to use them every day unless you have symptoms every day. If your symptoms are mainly in your nose, you're not having lots of hives and rashes, just nasal symptoms, you're better off using a topical antihistamine as needed to help stop the symptoms of histamine, which is itching and sneezing and postnasal drainage. Probably one of the most confusing medications are decongestants. Patients just don't know when to use a nasal decongestant. When it comes to allergies, when you have lots of inflammation inside your nose and there's not a lot of room for the air to move through your nose, you're probably going to benefit from a decongestant. Even though you're taking your topical steroids, you're washing your nose, and you're using an antihistamine, sometimes it's just not enough to help you get the air you need through your nose, and that's where decongestants come into play. There's two types of decongestants in general that you can use to help improve the airflow through your nose. Topical decongestants like Afrin or Neosynephrine or Vicks Vapor Rub, and then oral decongestants like Sudafed. So if you have heart troubles or if you have blood pressure, you shouldn't be using decongestants. If not, they're great to use on a temporary basis to help improve the amount of space inside your nose so that you can breathe better. The last product that patients often will grab off the shelf is Mucinex. So Mucinex is a mucolytic, which means it breaks up mucus. The last thing you want to do is grab a product off the shelf that makes your secretions even more watery and more runny. Mucinex is great when you have a sinus infection or a bronchitis. In those cases, you have thick, purulent, gross secretions that you're trying to cough up, and that's exactly what Mucinex does. It helps break up those secretions so you can get them out. So if you have just nasal allergies, stay away from Mucinex. Up to this point, everything we've talked about are medications to treat your allergy symptoms, but unfortunately, they don't cure your allergies. The good news is we have a way to potentially cure nasal allergies, and that's called immunotherapy. To do immunotherapy, you first have to get allergy tested. We don't test you because we don't know you have allergies. Of course, you're sneezing and having drainage and postnasal drip. We test you because we have to find out what your body's reacting to in order to give you those allergens in high doses over a long period of time. By doing so, immunotherapy reprograms your immune system to not react to all those things it's currently reacting to and therefore alleviates the symptoms.